Hi, good afternoon. I am Dr. Constantino, and welcome to our second Lunch and Learn series. Actually, we will be having more of this every month, so we hope you tune in and listen to us. So I am one of the neurologists working here at MedStar Southern Maryland. I am a Georgetown neurologist. I have specialized in movement disorders and trained at in New York, mainly Cornell and Columbia University. So I'm here to talk about one of the things that interest me and what interests patients a lot. We have, in my clinic, we have a lot of patients being referred for dementia and memory problems. And I would like to talk more about what is dementia, what is forgetfulness, what is memory loss. So I would start to keep the ball rolling, and we will be entertaining questions along the way, okay? So first is, what is dementia? It's a big term. It's an umbrella diagnosis, and it is what we call a syndrome. When I say a syndrome, it's a combination of many other symptoms. And one of the most discussed things in people with dementia is the element of memory. I forget things, I lost my keys and I don't know where I can find it. I know it was there, so questions of memory. I don't remember what date it is today. Thinking processes, behavior is one of the most important things that we'll be discussing later. And the ability to perform activities that you used to do are all affected when people have dementia. Alzheimer's disease is just one form of dementia, actually. It is the most common form of dementia, and it affects around 60 to 70% of cases. People with, as I said, it is an umbrella diagnosis, and Alzheimer's is one. There is another disease which has other symptoms of Parkinsonism or Parkinson's disease, like tremor and problems with difficulty thinking, and it's called, and hallucinations, called Lewy body disease. There is also one disease called frontotemporal dementia, in which people become more agitated and have behavioral issues. There is vascular dementia, which is secondary to strokes, mainly in the frontal lobe or any part of the cortex, okay? So there is a cartoon, I hope you could show your slides, but there is a cartoon that says that age doesn't make you forgetful. So it doesn't matter what age you are, you can be forgetful. It is the amount of things that you have to remember. Some are stupid things that you have to remember. Do I have to remember the name of a singer who I knew like 10 years ago or 20 years ago? And then you freak out because you don't remember it. So those are the things that we have to think about when we talk about dementia versus memory. So let me distinguish between forgetfulness and dementia, okay? First of all, not all forgetfulness is dementia. And forgetfulness, you can forget some details. For example, I know I have an appointment today, but I forgot the time. So that's okay. You can look at your schedule book, you know where to find your schedule book, and you retrieve that information. You often remember, or sometimes you forget information that has been reminded to you. You're maybe, like me as a physician, I have an appointment with doing a talk today, and I forget that it's today. Well, I know it's today, but I forgot that I should be there at 11:30 instead of 12 o'clock. So that is acceptable, I hope, okay? Third is, you are aware of your memory loss. This is most important because people who are forgetful are aware that they have memory loss, which means they have insight into their disease, as opposed to people who have dementia, in which they do not only forget that they have an appointment, that they don't know when the appointment is, but they forget they even have an appointment. And they cannot recall anything. You tell them that, okay, Mom, you left your key in the car, and she forgot that you even told her that you left your key, that she left her, remember that she left her key in the car. The other thing also about dementia is that you don't know that you have memory loss. You keep on denying it. I don't have memory loss, I'm okay. So those are the things that may be a key, or it's something that's a clue that you're dealing with someone who's demented rather than someone who's just forgetful, okay? So, question that I always ask, I get asked by patients, am I getting demented? What should I be concerned? Is this memory loss leading to dementia? Okay, so I would be concerned, or I would be concerned about a family member who keeps on forgetting even the special days. their birthdays. They forget it's their birthday. They forget their favorite son's birthday. They forget that it's Christmas, okay? So those are very common things. They don't even know what occasion it is. Not recalling or knowing where they placed things that they usually do know they placed it there. Like, for example, they put their shoes in the shoe rack, but then they do not recall that their shoes are in the shoe rack. They will look in the refrigerator somewhere else where and sometimes spouses find things in odd places. They forget about an incident soon afterwards. Like, they were going to the shopping mall, they bought something. They don't remember that they even got into the shopping mall. Then another key also, and this has been a study that was done, people who keep on repeating questions. Okay, they ask their spouses, they ask their children, did I say that? Or what did you say again? Did you tell me that? So those are clues that it may be something leading to dementia. Unable to learn new activities, okay, is another thing. Melanie has a question, but before that, let me just complete this because I think her question is related, okay? So not remembering stories or movies that you have watched. I guess if you watched the movie like 20 years or 10 years, and I would not remember it, but you just watched the movie yesterday and you don't know about it. Unable to do daily chores that you were finding easily done before. So if you have difficulty with them, or if a family member has difficulty with them, then I would suspect something may be wrong, okay? So Melanie's question is, my mom constantly repeats stories that she already told me. Does it mean that she has or is developing dementia? Well, it depends on what your mom's age is, because some people just like rehashing stories, especially if they know that you don't listen. I know there are people who keep on, telling things repeatedly just to emphasize, or they forgot what they told you. But if she just told you like 10 minutes ago and then she repeats it, then I will be concerned. If she told you the next day, I had this experience, then I may forgive that a bit. But if it becomes more frequent and consistently, and then you tell her, Mom, I think you told that to me, and then she tells it to you again, then that's a red flag, okay? So moving on, I guess am I getting dementia question, as I said, is always a question that's being asked, and that is what I clarify when I see patients in my clinic. The other thing that is also of concern in dementia is behavior. A patient who used to be outgoing becomes withdrawn, or a patient who's very quiet becomes very noisy, talking a lot, and usually they talk about things that they never talked about before. Some people have increase in, they have disinhibitions, which means that they laugh around a lot even if there's nothing funny, or they actually say sexual comments about some people when they never did this, okay? Now, another thing is they change their mood. They may be happy one time, and then they may be sad the next time, they may be crying the next time. That's another red flag. They become anxious too often, but I'm going to talk about anxiety and mood about later on. They have loss of control of their impulses. If they want to buy something, they buy something. There are people who spend tons of money, okay, buying the same things all over. Like, I just had a patient who kept on buying groceries when they only have already a whole closet of bathroom tissue, and she would still buy tissue paper, okay? So those are red flags. They lose the control of their impulses. They lose the control to hold back their anger or their happiness, or even, they just jump into something. They eat a lot, they binge eat, they binge drink. So and these are people who never did that. Again, related to your behavior is social appropriateness. If you're socially appropriate in certain conditions, and you're forgetful, that may be just forgetfulness. But if you're inappropriate and you talk to someone and it's really very embarrassing, it embarrasses people, that may be something that is not right. You have perceptions that people don't see. So people can have hallucinations. They could have delusions. Okay, or they'd say, I saw the president talk to me this morning. Or I saw a whole group of people who were clapping their hands when I talked. So those are red flags. Or maybe as simple as, I talked to my son when the son is in another country or in another place where there is no access to communication. Okay. Another question. How can I actively work to slow down the process of dementia from developing if it runs in my family? Okay, we will go through that later I have a piece on how to prevent, progression of disease if you have memory problems, okay? So we'll do that later. So we have behaviors, we have things that are inappropriate, so those are things. Now, Bill had asked a question of preventing dementia. So let me just tell you that dementia, as I said, is a syndrome, and there are other things that can cause memory loss or can mimic dementia. One of them is depression, and I would like to really emphasize that people who are depressed have a tendency to forget things, misplace things, be inappropriate in their behavior. So you have to make sure that there is no incident prior to developing this change in behavior. Another thing also is stroke. So you have to distinguish whether the patient had a stroke. And I always ask for an MRI or a CAT scan of the brain in people who they ask or they tell me has dementia, because it could be from a stroke. Another reason why people can have dementia are deficiencies in vitamins. And this is related also to prevention of how could I prevent being demented. You have to make sure that you are eating the right amount of food, or you have good vitamin D. You are not deficient in vitamin D, you're not deficient in vitamin B, or you don't have thyroid disease. I see a lot of people in my office who have thyroid disease. They are hypothyroid, they take thyroid supplements. Make sure that your primary care doctor knows that you are checked, because sometimes the medications may not be sufficient or they may be too much for your system, and that can tip you over on one end. Infections, by the way, can also cause you to have dementia. That's why prevention is preventing infection. So prevention involves making sure you have the flu virus, you have the pneumonia virus, because especially in elderly, the brain gets configured in a different way when your infection spreads into the system, into your blood system, and then goes into the brain. Okay? It's not only the meningitis that you hear about that can cause problems with dementia. Another thing that can mimic dementia, memory problems, behavioral problems, are seizures. So epilepsy. And epilepsy is another whole list of diseases that there are a lot of other diseases that can cause epilepsy. So you have to make sure that if this happens suddenly, that also has to be ruled out with an EEG, or maybe starting a patient on a low dose of a medication for seizure to see if it will reverse, okay? But preventing dementia involves sleep hygiene. You may have experience if you're not sleeping. I know this from students who have not been sleeping for many days. They're reviewing. They forget things the next day. They do poorly in their exams. They're not demented. Well, translate this into people who are working and they do a lot more in their activities and they don't sleep, or they get only 2 hours or 3 hours of not healthy sleep. Also, people have what we call sleep apnea. Remember, when you have sleep apnea, you have decreased oxygenation of the brain. And that can also lead into developing memory problems that, if it persists, can be or can mimic dementia and can sometimes lead into dementia. A healthy diet is always helpful for preventing, especially if you have a family history, a healthy diet will help. So you would just see people who are in the 90s who have good memory. Vegetables, less vegetables and fruits are usually their diet. They don't eat a lot of meat. Processed foods are less. I mean, they cook their own food. I think those are helpful in improving or in preventing you from having memory problems. Exercise is another thing. I see a lot of people who have retired who shun exercise or they watch TV. There have been studies in children that television has caused stunting in the cognitive functions of kids. So what more in older people have a lot of things that they're thinking about. You watch TV for 4 hours, 5 hours a day, even if it's a movie, even if it's the news, more so maybe because you'll get scared and anxious. But these are not good for your brain. What is helpful is going out, walking with friends, swimming, doing a form of exercise, whatever you feel like you're doing, dancing, whatever you feel you enjoy will help you both physically and mentally. Mental stimulation, of course, you need to continue whatever you have enjoyed before. Like if you enjoyed your work in computers, then tinker with computers. If you enjoyed cars, then do maybe some model cars. So these are mental stimulation. Have an active social life, which means it doesn't mean that you have to party and drink alcohol every day, but engage in friends, help. You know that there is a saying that if you help, others, you tend to get more out of that helping cognitively, because you modify your brain to make sure that you are doing things creative for others. And then, of course, stress management is another thing. I cannot downplay, everyone will have some form of stress, but do something about your stress. If you cannot do anything about it, and it's not cannot solve it with stressing out about it, I would suggest just forget about it. Let someone else deal with it, okay? And there's another question here from Lisa. Can you reverse dementia? Okay, if it is one of those things that I told you, the secondary types that can cause memory problems, they may be reversible. Like, for example, vitamin D deficiency. You take a lot of you replace the vitamin deficiency, then you will be able to maybe reverse the memory problems. But dementia per se, we're still working on that. It's part of the studies that are being done right now, and there are so many things being done by the NIH, pharmaceutical companies, first to see how they can prevent dementia from progressing, or finding out exactly what is the cause of dementia and maybe modifying that, okay? If it's nerve cells that have been modified in the brain, it's harder. But I believe in plasticity, and there have been so many studies on the brain being plastic, and that when you do something, it's like exercising. When you do something repeatedly, your muscles build up. I think it's brain muscles as well. So if you have some forgetfulness and you try to do some things geared towards that, maybe if you want to improve your mathematical ability and you do math calculations, maybe that will help with reversing, or not reversing, but stopping the progression of dementia, okay? So treatment, which is related to how can you reverse dementia, it's the main thing is reducing the cognitive symptoms through medications. I would not talk into that because it's a whole slew of chemical components of medications that might help. Reducing the behavioral symptoms. I would like to stress that if you have a family member who is already having beginning dementia or beginning Alzheimer's, it is helpful not to stress them out with saying, oh, you're so forgetful, what is happening to you? Just don't scare them. Relax, Mom, let's go to the doctor, let's see what we can fix and see if we can change this. Because once they get more agitated, then they're going to withdraw and you cannot help them, okay? Now, if they have behavioral symptoms that are unsafe, like, for example, they have hallucinations in which dragons are fighting them or a whole army is up to them, then we have to treat that with medications, okay? There's no treatment that's non-medication for those kinds of symptoms. And we mentioned about decrease or slow the progression of the disease and prevention or delay of onset of disease. And that is something that is always being reviewed and done. There are so many studies that are being, as I said, done right now on both chemicals, on ancillary measures, on herbal supplements, on other ways to prevent dementia from getting worse. Question is from Angela. I have a strong family history of Alzheimer's. Does that mean I will have this disease someday? It's hard to tell. We don't have a risk. Well, there is a higher risk, but it is not always like 100% that you're going to have the disease. Again, as I said, there are many forms of or many causes for memory loss. Before you get into dementia, there are many things that you have to consider. So you have to take care of those things before we even say that it's dementia. But I would say it is a higher risk, but it's not always true that if you have a family member who has dementia, you're going to get demented later on, okay? You have to do whatever you can do to prevent it from happening, but again, live a comfortable and a healthy lifestyle. That may, if ever you have other secondary causes, that may prevent it from happening. Okay. Again, for Alzheimer's dementia, there are specific treatments which I'm not going to tell you. I think this is too short to discuss all this, but if you come to my clinic, I usually explain all the medications and the side effects of the patient. Vascular dementia, I just want to emphasize it, that strokes cause dementia. That is why if you have risk for strokes, hypertension, diabetes, high cholesterol, that has to be treated in order to prevent you from developing the vascular type of dementia. If you already had a stroke, you have to be tested. Make sure that we are doing the rehab part and also the cognitive rehab part and the physical rehab part so that you could get as much benefits or rehabilitate the part of the brain that had a stroke. Okay? So next is support for dementia. This is mainly for family members who already are dealing with people who are demented and who have memory problems. Before I go into that, Kate wants to know, what should you do if you think a family member has dementia? Kate, I would just advise you to go to your primary care and just make sure the general blood tests are checked, okay? Because as I said, those can be repleted and it may not be dementia. And then if it still continues, maybe 2 months, 3 months, you're repleting her vitamin D and she still is failing and you see all the red flags that I talked about, then maybe have them come see a neurologist and we can tease out what are the other causes of the memory loss, or whether that patient or that family member of yours has dementia. For those who have already are dealing with family members who have dementia, okay, support is very important. Love for the family, kindness, empathy, being patient with the family member. I just had a patient whose family is very annoyed with her because she keeps on, badgering them about her money. And she keeps on saying that, you did not give me money. Yeah. So I said, you know what, just be patient. Make, fake money. Sometimes they don't know which is fake money, which is real money. Show them, photocopy like a dollar bill and give them dollar bills that are photocopied so that they will be happy. Support them. I mean, it's important for you not to get angry, not to butt heads with them, because that's when they get more agitated. Again, important to be flexible with the family member who has dementia. Provide safety. If it is unsafe, then definitely we have to treat or place them in a place where they are going to be protected. There are certain non-medications that may help. Music, if a patient loves music from the 50s or 60s, play it with them. If they want to look at pictures, show them pictures. I always ask patients what their occupation was before and if they enjoyed their job. If they, for example, have been a writer, give them a notebook and let them write anything, no matter what. If they have been a painter, give them paints and colors and have them draw something, because that will help. Okay? Focus on the strengths of the patient that has dementia. If they're good at being nice and, they want to go to church every day and pray, support them in going to church and, helping other people and saying nice things about people. And it's also nice to reminisce the past with these patients, because that will instigate or stimulate their memory. And sometimes it's nice to give them a good feeling that, they have been once this type of person that they are different from right now. Some of them have pent up memories that can get out of their system. And it's nice to see a family member who is, very, who you think does not forget things, and then suddenly they remember, oh, this is my grandson. And that's something that's a nice feeling, not only for the person who has lost their memory, but also to the family members. Okay, Danielle wants to know, how can the caretaker, family, etc., self-care when taking care of someone with dementia? I am very concerned about caregiver burnout, okay? So the caregiver of a demented person needs to take care of themselves as well. So everyone in the family should pitch in and give time, not only for the patient, but for the caregiver. Because the caregiver can flip out if they don't have enough support. And self-care only, Caring for the patient means also caring for the caregiver. Usually it's the spouse who's the caregiver, okay? So children of patients who are demented should be supportive, grandkids should be supportive, and if they can find, I mean, if you have the means, I always tell a caregiver, if you have the means to support yourself or to have someone take care of this, then find someone who can take care and take time out from this. Because if you don't take time out, you're going to be burned out, you're going to be angry, and it's not good also for the patient, it's not good for you. Okay? I guess that was any additional questions. I think I have discussed a bird's eye view. I am encouraging you to look at the Alzheimer's.org website. NIH has a good website on aging as well. Georgetown, we have we have a dementia center, and we have a lot of physicians who are dealing with the different types of dementia, from Parkinson's disease, from diffuse Lewy body disease, from stroke. So Georgetown, our group, has a lot of other resources that you can go to. So, and as I said, I'm always here. I try to communicate with the primary cares, with the whoever internists that you have, so that we can make people more aware of how to take good care of people who have already been diagnosed with dementia, but more so for the people who are worried that they may be coming up, or they may have a family member who has dementia, or they have signs and symptoms themselves that may be a red flag, okay? But please, as I said, don't stress yourself out. Let us take care of it, because if you stress yourself out, then when I give the test or the mini mental status on you in the exam and you fail, that's even another stress on you, okay? So I hope everyone has enjoyed this lunch and learned.